Hello, I'm Dr. John McCann. In addition to performing Botox injections at the Center for Facial Appearances, I also receive the injections several times each year. I can still remember receiving my first Botox procedure, and despite having performed the procedure many times, I was somewhat apprehensive about the Botox procedure. I have prepared this video of a patient receiving their first Botox injections in hopes of alleviating any apprehension you may have about the procedure.
Smile really big for me. Okay, so now in some people that brings out a lot of wrinkles in their crow's feet area, and you get a couple, but not a lot. But we could use a little bit of Botox to get rid of those areas. Frown for me really big. Ooh.
I did it right there.
We call that the 11, and you don't when you relax your forehead, that goes away completely at this point. But if you do that for another 10 years, do you have children? You don't have any children. You have a husband, though, right? You don't have a husband? You have a boyfriend. Mm-hmm. Okay, when you scowl at your boyfriend like that, eventually that wears into your face. So getting Botox there helps prevent wrinkles that are permanent in that area. And then lift your eyebrows up for me once too. So that's another area where a lot of people get a lot of wrinkles is in the top of their forehead.
One really important issue when receiving Botox injections is that it's something that is comfortable for you. I don't like hurting people and also don't want you to be hurt because I'd like you to come back and get Botox injections again sometime. One way I can help prevent you from having any pain during the procedure is to use a topical anesthetic cream. This is a special topical anesthetic cream that we have custom made at a pharmacy, and one thing we like about it is it's very effective. It gives you a nice dense numbing of the area with only 10 minutes of application. Here you see a bottle of Botox. Botox is actually provided as a dried powder in a 100-unit bottle. That bottle is then reconstituted in 2 cc's of sterile saline. In your case, I'm going to inject about 1/2 of that bottle, or 1 cc of sterile saline. I'll be using a 32 gauge needle, which is the smallest needle manufactured. And the reason I'll use such a small needle is to do everything I can to keep you comfortable during the procedure. The topical anesthesia has been in place now for about 10 minutes. I'm going to go ahead and wipe away any residual anesthesia that has not absorbed into your skin yet. I think it'll make a big difference for you. I'll have you start by frowning for me. That helps show me where I want to give the injections in the area between the eyebrows. This first injection is going into the procerus muscle. I'll have you frown again for me and give another injection into the corrugator muscle. This complex of the corrugator and procerus muscle are the ones that contribute to that 11 between the brows. I'll have you turn your head to the side now and give some injections into the orbicularis oculi muscle. You can help me here by smiling a little bit so I can see exact location of the wrinkles. That's good. Now 2 more small injections in this area to help neutralize those crow's feet wrinkles. Okay, go ahead and lift your eyebrows up for me. Great. That shows me where your frontalis muscle is affecting your skin. I'm going to give some injections here right into the frontalis muscle to help weaken that muscle a bit. I'm very careful to stay towards the center of your forehead. In some people, giving injections towards the outer lateral part of the forehead can actually cause their eyebrows to become droopy. I'll also give you just a little more up near your hairline so you don't have any creases up in the region of the hairline. I hope you found that useful. Please browse the website further to learn more about Botox or other procedures we perform at the Center for Facial Appearances. If you have questions or if you are ready to schedule a consultation, please do not hesitate to call the Center for Facial Appearances at 801-363-3355. Realize that if you have the Botox procedure performed on the same day as your consultation, there will be no charge for the consultation. Thank you.